coming to adenocarcinoma, here this is the most common non-small cell lung carcinoma. It happens in both sex and in middle age group. It begins in the gland of alveoli in the outer part of the lung, and it always tends to be peripheral. The most important thing about adenocarcinoma is the metastasis. Lymph node metastasis is around 80%. Liver, it is around 45%. Bone, 35%. Adrenal, it is 35%. Kidneys, it is around 30%. And cerebral metastasis is around 20%. So, it is going to be an extensive metastasis, and metastasis early to brain, bone, liver and adrenal. Another important thing is it invades extra pulmonary structures like chest wall, diaphragm and pericardium. Almost all pancreas tumors are adenocarcinoma. You have to understand that. And they can be hypertrophic pulmonary osteoarthropathy, and whenever it happens, most common tumor is always adenocarcinoma. And coming to paraneoplastic adenocarcinoma, here it can secrete tumor antigen, cytokine, growth factor, metabolic factors like corticotrophin, extracellular protein and immunoglobulin component, and this goes into the circulation and cause systemic effect. For example, it travels to the kidney and can cause paraneoplastic nephropathy, which can lead to capillary loop collapse, glomerular deposition, intratubular cast, renal fibrosis, and they can be renal inflammation. So, what is produced here can travel to the systemic circulation to the particular organ and can cause damage to that particular organ. That is paraneoplastic adenocarcinoma. And coming to another important rare type of adenocarcinoma, which is bronchoalular carcinoma. It is a subtype which is not related to cigarette smoking. Another important thing which stands out is the alveolar architecture is not destroyed. Here, it lines the alveolar membrane with the thin layer of tumor cells, but the alveolar architecture is not destroyed. Another important thing is, here you can try lung transplantation because it has low potential to spread outside the lung. Now coming to large cell undifferentiated carcinoma. It is the least common type of non-small cell lung carcinoma. It begins in the large cell anywhere in the lung, but mostly in the outer part. It begins in the large cell anywhere in the lung, but mostly in the outer part. The rapid growth rate may lead to widespread metastasis, very similar to adenocarcinoma. Undifferentiated carcinoma, lung carcinoma, often presents as cavitating peripheral tumor. Now coming to small cell lung cancer. It is also called small cell or hot cell carcinoma. It is a tumor of neuroendocrine origin which involves a nerve cell or hormone producing cell. It is metastatic on presentation, and what is very important here is it is regarded as a medical disease and surgery only very rarely indicated. Coming to the staging, it can be stage limited. It is found only in one lung and the nearby tissue. In extensive, the cancer has spread to the other lung and there is widespread metastasis. In limited stage small cell carcinoma, you go for a combination chemotherapy either with etoposide cisplatin or a cyclophosphatide doxorubicin vincristine combination, which gives objective response in over 80% of the patient. Aggressive radiotherapy and prophylactic cranial irradiation should be done in addition to this chemotherapy. In spite of that, tumor invariably recurs and it is quite resistant to further treatment. The overall survival rate is less than 10%. Extensive stage disease is treated with chemotherapy and palliative radiation as needed.